Hello everybody and welcome to Neet Mentor. In the particular video, I am going to talk about DNB versus MDMS comparison. Last year, it was somewhat different from the current 2021. If you talk about the counseling pattern, there will be a little bit of change that I will talk about, and the different factors that you keep in mind before choosing DNB courses and DNB versus MSMD. So if you haven't subscribed our channel yet, so you can subscribe to our channel, and you can also go for our paid services. For the paid services, you can call us to the number given on the screen, 9319128677. So let's get started. So first thing first, starting from the beginning, what is the difference between MDMS and DNB? So first difference that I will tell you, I have created a chart. Okay, so it gives you each and every difference in tabular format, so you can have a look, but I will tell you all the things. So both the courses DNB and MDMS are post graduation courses. After you have done MBBS, then only you can go for both the courses. The duration is 3 years only, and post diploma courses for both. This year 2 years DNB diploma course is a newly launched course by NBE that will also be of 2 years. So post diploma courses will be of 2 years. You can do super specialization after DNB also. The main difference, where you have to think, if you haven't scored very good to get a government college MSMD course, then you can go for, then you have two options you have. The first option is private college, where you go for top clinical branches like pedia, radio, derma, medicine, obsgyne, ortho. For these branches you have to pay around 30 to 40 lakhs per year, or in some colleges where the budget is quite low, in Karnataka you have to pay at least 11.5, whereas the tuition fee in DNB is just 1.25 lakhs for any college, any hospital, and is fixed. Okay, on top of that, in DNB you will be getting a smart amount of stipend, and you get good hands-on also. I will talk about hands-on separately in this video. So the amount you need to pay as tuition fee is very less in DNB compared to MDMS. So that's a point where DNB wins over MDMS. Okay, but what is the drawback of DNB over MDMS? See, in MDMS you get admission into college and you have a professor. They will help you in your studies. Okay, and you can learn from them. You get the opportunity to learn from doctors also in hospital, in medical colleges. But coming to DNB, getting admission is easier than MDMS, because you don't have to pay much tuition fee, and in low score also you can get top branches. Okay, but the problem here is the passing rate. As we see that we have improvisation in the passing rate, but still it is up to you and how good is your learning ability, because you don't have professors over there in hospitals. You need to learn from doctors, so you need to see how good are the doctors there, and how is the patient flow in hospital, the number of beds. So you can see the slide, patient footfall, that is patient load, good number of beds that is required, and the hospital should be meeting the MCI criteria. Both the courses are now equivalent, DNB and MDMS. But talking about MCI criteria, the hospital that has 500 plus beds, and they have at least three guides like SR or the senior doctors over there, who can help you in your studies or hands-on. So these are necessary to meet MCI criteria. Okay, hands-on opportunity plays a very big role in hospitals when you are going for DNB, especially for surgical branches. Okay, you need to see the locality. Normally central government hospitals like railway, corporate hospitals, research institutes, These hospitals are very good for DNB courses. You need to see the service bound duration also. Most probably in the district hospitals you have to have a service bond. You will have service bond, and stipend amount is good. Minimum 37,000 will be paid in any state, and depending on the states like Rajasthan, Delhi, Haryana, and UP, these states will pay you higher amount. How good is particular hospital for particular branch? You need to see. So you need to have a detailed analysis about hospitals. So and based on that you need to decide. That's where our paid services will play a big role. 93191286 and 77. You can call on this number. And there are other factors like how cooperative are the doctors. Do they get you involved only in the paperwork, or you get the hands-on opportunity as well? In big hospitals it happens for the serious surgical operations, they only ask their senior doctors to take care of it, and you don't happen to get good amount of hands-on opportunity. You have to see all these things when you're going for DNB. Just getting admission is not the one thing that you need to consider. Getting college allotted is one thing, and getting the best college allotted, best hospital allotted based on your counseling process is the most important part, because that will play a big role in your future. And after MBBS you are doing PG course, and that's very valuable. So you have to think a lot before you choose a particular hospital or particular college. Okay, so let's see other factors. So most of the factors are same. Both the courses has very good recognition nationally as well as internationally. Talking about DNB internationally, DNB from few years they are getting better recognition than MDMS, because but if you talk from normal people, they are more aware about MDMS. So and DNB course is something like new to them, but it doesn't matter much as long as you have a good experience, good practical exposure, surgical exposure, then you are good to go with your all the options in the future. So you can pause the video and you can read through all those things in the teaching skill. It's similar, but there is a kind of partiality, I would say. MDMS candidates are more preferred in teaching or faculty's role, but these differences are getting eradicated every passing year. So if you are very good or confident candidate and don't want to spend so much amount of money in your studies, then you can go for DNB, because it's up to you how much you learn and how quickly you grab the opportunity and your learning ability and everything, so that you can pass the final exam, external exam. So that's it from this video. If you have any more questions and change in pattern, I will mention you the change in pattern this year. You will able to see the MDMS and DNB, both the counseling will go in parallel and combined starting from the beginning. It is to happen after couple of rounds of MDMS is over, then DNB is to start its counseling. And earlier NB used to do the counseling for DNB and MCC used to do the counseling for MDMS courses. But this year MCC will do the counseling for both for DNB and MDMS. So both will go in parallel, and you can see little bit of cutoff changes due to this factor. Since both will go in parallel and combined counseling will happen, there will be chance for negative shift. But if you see from last year, because last year we were the counseling process got so much impacted by COVID-19 situation, so the last round of DNB used to happen offline at Dwarka Center in New Delhi, and very few candidates used to come. If anyone from South India, the number of candidates used to visit Dwarka Center for offline counseling was less in 2019, but in 2020 actually it happened online, so the last round cutoff went high. So this year it's expected that the last round will be happening offline as usual, and it will make a great impact in the cutoff marks. So those who are very opportunistic to get DNB, they can also wait until last round of DNB, and they can hope that in the offline counseling they can grab a good branch in poor rank also. Okay, so these are my some of opinions about DNB versus MDMS. So if you have any more question, you can call us, and you can subscribe to our channel. There is a link given in the description for Telegram. You can join that link. We will give you all the counseling related updates in that link. So thanks for watching, guys, and have a nice day.